Dr. Paul Zweibel, a plastic surgeon in Denver, Colorado. For this video blog, I wanted to talk about what to do if you develop a capsule contracture. So for those of you who've had breast augmentation surgery, about 5% will have the possibility of at some point developing some firmness or hardness of the implant. Capsule contracture is a situation where the breast implants lose their softness. When they get bad, the capsule contractures can actually cause a distortion, an unnatural appearance, almost like tennis balls right under the skin. But even before that point, if you found that over time your breast implants don't feel as soft or the shape isn't quite right, the problem may be a capsule contracture. Now there are some things that you can do to make that situation better. First of all, it always takes a personal consultation depending upon the type of implants, how long you've had the implants, and also the degree of capsule contracture, how bad it is. And then your surgeon can personalize what might be the best approach for you. But let me give you a few examples. So when I see a patient who's had a mild capsule contracture, one of the first things that we're going to try is a more aggressive manipulation around the implant. And we can show you how to actually move the implant in the space under the breast to try and soften the capsule to make it feel less hard. Together with that, sometimes we'll actually use a combination of anti-inflammatories and some other medications, though there really isn't a medication that is surefire. At this time, some of the medication protocols we have work only about half the time or a little less than half the time. But in certain instances, it's certainly worth a try. Now, what if the capsule is a little bit more severe, or if it doesn't respond to those kinds of conservative measures? Then the next thing that we might try is actually just to go in surgically using the existing incision and go in and recreate the capsule. One way we do that is by actually making cuts in the capsule that allow that space to expand. So just by doing that, that will oftentimes bring the softness back. And then by manipulating the implant within the space, we can keep that space open. Other times, if the capsule is really thick and scarred, what we need to do is actually remove that capsule completely and give the body an opportunity to form a new capsule. Generally, when we do that procedure, we'll want to put in new implants as well. So there are really several options that we can pursue to help restore a very nice, natural, and soft appearance if you've had breast implants. The best way to find out what would work for you, though, of course, is to set up a consultation. So please call me at 303-470-3400, and I look forward to talking with you and figuring out what might work best. Thanks very much.